Hi, my name is Valley. I'm a student nurse at Rhodes State College. I'm going to be performing your sterile dressing change today. So first I'm going to wash my hands. Okay. Can you please tell me your name, date of birth? Okay, Tobias Mendoza, 6/23/97. So I'm going to check his wristband also. Now I'm going to compare it to my physician's orders and my treatment administration record, and everything matches. Do you have any allergies I should be aware of? Any tape, latex, anything like that? No? Okay, perfect. So, are you in any pain? And he said no, but if he said yes, I would prescribe him I would administer his pain medication and wait 30 minutes for the pain medication to kick in. So, I'm going to make sure it's okay with my patient to just position my red bag right below your feet right here. Okay, perfect. Making sure that it's wide enough for me to toss my contaminated objects in it. Okay, so now I'm going to go check my 6 rights for my medication we're going to be using today. And that's 0.9% sodium chloride. So I'll open this and compare it. Okay, so dose would be as much as it would take to fill up my sterile bowl for the dressing change. Route, topical, time, now. Individual, Tobias Mendoza, medication, 0.9% sodium chloride. Expiration date, 12/21. So I'll do that 2 more times. So dose, as much as it would take to fill up my bowl. Route, topical, time, now. Individual, Tobias Mendoza, medication, 0.9% sodium chloride, expiration date, 12/21. And for my last check, my dose, as much as it would take to fill up my bowl for the dressing change. Route, topical, time, now. Individual, Tobias Mendoza, medication, 0.9% sodium chloride, and expiration date, 12/21. Okay. So I'm done with that. Now, before I start, I'm going to assess my patient to see if he has any drains or tubes, and he doesn't, so we're good. Now I'm going to sanitize again and place my gloves on. And we're going to start undressing the wound. So when I undress the wound, I'm going to want to make sure that the abdominal pad is untaped, obviously, and pulled away from the patient so he can't see. And I'm going to be measuring the color, the odor, consistency, and amount of the abdominal pad. Toss it into the biohazard bag. Color, odor, consistency, and amount of the gauze. And again, color, odor, consistency, and amount. Okay. So now I'm going to assess the size and the drainage of the wound, the color, the odor, the consistency, and amount of anything over here. And if he had any stitches or sutures, I would assess those also. Assess any drains or tubes, again, that he has, but he doesn't have. So we're good. So now I'm going to remove my gloves. Toss them in the bag. Come back over here, use my sanitizer again, and I'm going to start opening up all my supplies. So first I'll start with my saline. It's an unopened bottle, so I don't have to buff the top, but if it was opened already, I would buff it with an alcohol pad for 15 seconds. So I'm going to make sure that the cap is upside down. I'm going to lip a little bit, making sure that I have a trash can reach. Lip a little bit into the trash can. And then fill it up with as much as I need to do my dressing change. Recap solution. I'm going to come over to my abdominal pad. And in a real life situation, these would all be closed, but I only had a few to work with, so I'm going to do my best. Okay, so I'm going to open my abdominal pad, making sure that nothing touches the outer edges. And I don't hover over anything to contaminate it. Okay, so my abdominal pad's open. Now I'm going to come over here. I'm going to set these so I have more room to work with. Now I'm going to start with my gauze. Okay, so my first piece of gauze, I'm going to open it away from me and make sure that I don't touch anything with it. The second piece. Again, the outer 1 inch of each package is unsterile, so I can touch that, but I can't let my gauze touch anything else. So go over here. Okay. So now I'm going to open this, making sure that my hands don't cover this. And for my last piece, now that those are open, I'm going to come over to my sterile gloves. And these also, in an ideal place, would be unopened, but I needed to reuse them. So here we go. So first I'm going to open them carefully. Now I'm going to reach under the folds, pull it apart, and straighten out the edges so it doesn't flop back over. Now I like to take my non-dominant hand so I can only touch the cuff. So I'm going to do that, barely touching it, slide it in so my thumb doesn't touch any of the outer parts, and can reposition it one time. So now, since this is a sterile hand, I'm going to grab my cup, put my thumb at a 90-degree angle as to make sure that it doesn't contaminate anything. And I'm going to slide that on too. So now that I'm considered sterile, I can't put my hands anywhere below my waist. So first we're going to start over here. I'm going to take my 2 gauzes, there's 2 right here, place it in there, and I'll take this one also. I need 1 out of this, place it in there. Okay, so when they're all ready to go, I'm going to wring them out, and I like to put them all in my hand so it gives me a little more time over here. So my first piece of gauze, I'm going to start cleaning the center first. So top to bottom, center, throw it into the bag. Okay. Now I'm going to go to the outer side, fold my gauze, top to bottom, trash, and top to bottom, the side closest to me, and then trash. Now I'm going to come back, I'm going to grab my last piece of gauze from this pack, and I'm going to grab 2 more to start drying. And I'm going to dry the same way, starting at the center, top to bottom, trash, outer, top to bottom, trash, and closest to me, top to bottom, trash. Now we're going to redress the wound. So I'm going to take my last 2 pieces of gauze, place them just like the other 2 were to start with. There we go. I'm going to come over here carefully, still not putting my hands below my waist. Grab my abdominal pad, and we're going to apply that. Okay. So now that my abdominal pad is on, I'm going to take my gloves off the appropriate way, and I sanitize my hands. Okay. So now I'm going to tape and back up. Starting at the top, he needs 3 pieces. All right. There's 2. And 3. Okay. So now that his wound is redressed, I'm going to take care of my supplies. I'm going to re-sanitize my hands, and I would document and discard of my biohazard bag in the appropriate place.